All right, so today's topic is about pain. And, as a chiropractor, one of the things that we think about as chiropractors, what do chiropractors, what are they known for? What do they typically help with? What do you guys know? Back?
Neck?
Neck, yeah. And possibly headaches,
Uh-huh.
right?
Or treating maybe after accidents, especially car accidents.
Right, car accident doctor, exactly. And all those are related to what? Pain, right? Pain, neck pain, back pain. And so, chiropractors do a really great job about that. I mean, there's actually quite a bit of research that shows that chiropractors are the best in helping with back pain, the best in helping with neck pain, headaches, all those things. And in fact, I've been in practice for over 17 years, and that's what I've noticed. Patients coming in with pain, they get relief almost like right away. Like that's they notice that. I had a patient who came in with foot pain, and as you know, I do upper cervical chiropractic, so I adjust the neck predominantly. And I didn't even touch her foot, and I adjusted a lower part of her neck right about the C7 level. Foot pain went away. So the pain part is not the difficult part. The challenge that I find, and maybe I can talk about why does one have pain first of all. Our brainstem contains about 3 trillion nerve fibers. There's quite a bit of nerve fibers, and about 20% of those nerve fibers are related to pain. So meaning all this, what your body's going through, it sends messages through a sensory pathway that goes to your brain, and then your brain interprets that information and it determines whether it's painful or not. And when you have nerve irritation, like let's say a bone that's out of place, it's irritating this area. It actually amplifies your perception of pain. And sure enough, when I make an adjustment in the neck, what happens? We turn down that pain. We turn that dimmer switch, if you will, of pain down. So that's why I say it's the easy part. The remaining nerve fibers, the 80% of the nerve fibers that run through that brainstem, has to do with function, how your body functions. So, and that's how the brain connects with your lungs. That's how your brain connects with your heart and your digestive system, right? And your muscles. So, think about this. When you have poor function, when your body's not functioning adequately, do you have any pain? No, it's not related to pain. A good example is I had a patient who, I may have shared with you, but her boyfriend was in his early 40s, very athletically fit, and one day, I saw her again, but one day she said that my boyfriend died of a heart attack. Had no symptoms, very healthy, fit. But what that shows you is that the heart attack was his first symptom.
Yeah.
Right? That was his first symptom. His body was not functioning right. His heart was not functioning right. But no signs of it. No symptoms of it. You see how dangerous that is? So when the body's going through this degenerative process where the body's not functioning, is dysfunctional. If you don't do something about it, unfortunately, you don't have any way to find out. So most of my patients who come in, they come in because of symptoms. They come in because of pain. And it's unfortunate, but kids, did you know births are 80% traumatic to the neck? So do you think kids need to be checked when they're born? 80% of them go through some type of a traumatic event. So the C-section is a good example. Did you know hospitals, 50% of deliveries are done via C-section? Brazil is about closer to 70%. C-sections are not good for the neck because the doctor typically will cut a small slit in the abdomen, pull the baby out from the head and the neck. And sometimes If you guys ever have a chance, look on YouTube of how C-sections deliveries are done. Some of these doctors, they yank on the neck, and you see the neck distended like this, and it's because they think that the kid's neck has a 2-inch give, which it does actually. The ligaments are very flexible. The only problem is the brainstem itself, that's in there in the neck, has a 1/2 inch give. So they're pulling on this brainstem, yanking on it, causing all sorts of problems. So the kid comes out, all blue, having difficulty with breathing, have asthma, which leads to the next point, which is your function of breathing. Certain people like myself, I grew up having a wonderful dad that smoked, and then when he passed away when I was 12, my stepdad came into the picture. He smoked, so my lung capacity was just not there, and I learned to live with it. I thought, oh, I'm normal. I have no condition, and come to find out when I was like 28 years old, I had asthma. I had severe asthma. There was one time I was maybe 21 years old. I checked myself into the emergency room because I stopped breathing. I didn't know any better. But my body was not functioning right. And thankfully, when I was about 28 years old, I came across an upper cervical doctor that was able to help me. He adjusted my neck, and it didn't happen right away. By the way, the symptoms didn't resolve right away. In fact, it took 3 months. And after 3 months, my asthma went away. Actually, before those treatments, when I would have a conversation with anybody, I would cough. I would have this nervous cough. Or my breathing wasn't really optimal. And think about this. When you don't breathe optimally, what happens? There's not enough oxygen that goes into your cells, into your brain. And so it's no wonder I couldn't think straight. It's no wonder I had brain fog. It's no wonder, I was always tired. Always tired. And now that I've got my function back, my breathing back, I'm doing much better.
Yeah.
Another example, I guess, about function is my car. It was, how often do you change your oil? Typically.
Yeah.
3,000 to 5,000.
5,000 miles. I didn't change my car oil for about 10,000 miles. No, I'm kidding. I don't drive much actually. For a whole year, my car puts on maybe 3,000 miles, if that.
Wow.
I don't drive much.
Yeah.
My house is about 2 miles away from my
Yeah.
office, so.
Wow.
So for a year, I didn't change my oil. I think following the rule, I was in the guideline. It's about less than 3,000 miles on the damn car. So I didn't do anything about it. And sure enough, as I'm driving on the freeway, I get this, red light, the engine's saying, turn off your engine, oil low. And as it turned out, the oil was, I guess it dried up or burnt out or whatever, but I had no oil in the engine. And I had to pull over. I had no symptom. that the car was low in oil until this, flashing thing. And I thought, oh, maybe I'm just short on a quart of oil. So, I pull into the auto shop, auto parts store, and sure enough, they only sold, they had it in a quart, but I wasn't sure how much I needed, so I decided to just get the whole box, the whole case, just in case I need a refill. The case had 6 quarts in them. I filled all 6 quarts.
Really?
I was driving around with no oil in the car. You see what I'm saying? Talk about function. The engine, thankfully, because what I use full synthetic oil. For some of you guys know, full synthetic oil is oil that actually bonds to the parts, the metal parts. So I think that's what saved me, because if I would have used regular oil, I would see smoke coming out of the engine. That's my first symptom, right? And so bottom line is that our body relies on our ability to function, our ability to breathe, our ability to pump blood through our heart. And high blood pressure is another example. We can have high blood pressure and not know about it. Until what? So you go to a CVS, you get that blood check, or you go to your medical doctor, you get blood checked. Other than that, you don't know you have high blood pressure. You can have a stroke, in a heartbeat. You can have a heart attack in a heartbeat. It's not even about age.
Yeah.
It's not even about age.
Yeah.
Isn't that interesting?
Huh.
So what I do as an upper cervical doctor really is to help my patients improve their function, optimize their function, so that the body works optimally. And it's not about pain. It was not about pain. Because when patients come in, their pain's gone, guess what? A lot of times we live in a culture of what? Pain. If my pain is gone, I'm well, I'm good, right? So pain is not my focus. Pain is too easy. Pain is the easy part. Getting them to function, getting their body to function optimally, that's really the challenge. Getting them to hold their adjustment, because their alignment, their misalignment has been like that for years. Sometimes I get patients coming in with, really bad misalignment. I had one patient came in, he was just coming along with his girlfriend, actually. His girlfriend was my patient. She was very symptomatic, but he was not. He was very fit. But he came to one of my talks, and he was like, oh, I should get checked. And sure enough, when I checked him, legs was off. He showed all these objective findings that he needed to get the care. And he goes, okay, sure, let's get some X-rays. And when I took his X-rays, his atlas plane line, normally it should be angled about 15 degrees, kind of pointing forward towards the face. His atlas was sitting like this, pointing downwards.
Yeah. Wow.
No history of trauma whatsoever. I go, did you have a car accident? No. My guess, and I alluded to this, is that it might have occurred when he was born. Just a guess, because he's lived with it for most of his life. And his body was able to adapt to it. Our body's really good at adapting. Like if your shoulder's like this, when your posture's off, your body will start to shift. And it'll go, okay, the hip will go shift and the head will pull, whatever it does, to make you feel comfortable, to make you, live with it and survive. That's what our body's good about, is allowing you to survive and adapt. But is that a way to live? Until the ticking time bomb occurs, right? And then you start having arthritis in the joints, arthritis in the spine, and discompression, right? And all of a sudden they wake up like, why do I have back pain? Why do I have neck pain? Why do I have breathing problems? Why do I have all these things happen to me out of nowhere? It's because your body can only function to a certain point until it crashes, just like my car. Thankfully, it didn't crash, right? So that's what I do. I help my patients function better.
Yeah. Very good. Very good.